Hello, I'm Irma Baker. Welcome to our show. You know, at this time of year, so many things go on. We think about Thanksgiving, we think about upcoming holidays. There's something else we have to think about this time of year. And after these few words from our sponsor, RSVP, the Retired Senior Volunteer Program, we're going to look at those.
RSVP of Summit County has been making a difference in our community since 1972. RSVP volunteers are increasing the quality of life by participating in programs and organizations that provide important services to the community. RSVP matches personal interests and skills with opportunities to serve. If you're interested in adding more meaning to your life and improving the lives of others, please call 330-253-4597, extension 166.
Welcome back. At this time of year, we're also looking at healthcare enrollment. This is that open enrollment period, and there are so many questions about that. So we have asked independent insurance agent Bonnie Victor to come and help answer some of our questions. Bonnie, it's wonderful to have you with us today.
Thank you, Irma, and thank you, Wadsworth. I'm glad we're going to spend a few minutes talking about a field that's dear to my heart.
Well, first of all, I have to say, I didn't know anything about independent insurance agents. What is it and how did you get into it?
Wow. Well, independence is a key word in my book because that means that I don't work with just one company or two. My allegiance is really toward the client. If I work with someone, they're important to me, not the insurance company. And I like that fact that I work for the customer. Independent means that if there's a good plan out there, I will find out about it and I'll bring it to my clients.
So you're familiar then with maybe 2, 3, 4 different companies or more than that?
Actually, it's probably more like 30, 35. New ones come on, others get bought out. It's an ever-changing field. Healthcare anymore is change, change, change.
Oh my gosh, I know. I keep getting all these things in the mail from this company and that company, another company, but you work then for the client, and as the client representative, essentially, you're looking at plans from all these different companies. What are some of the companies that you're familiar with?
Well, the major ones here in Northeast Ohio are Humana, Aetna, Anthem Blue Cross, United Healthcare. There's a couple called Altrua Health Share, the Christian plans. Medico, little small companies. I work with small ones, large ones. I could go on, but I don't want to bore you.
How did you get into it? Have you always been involved in insurance?
15 years ago, I had a career in marketing and advertising, and I did a life change, and I was recruited in on the financial services side. And I started with United Teachers, and I was counseling retired school employees and teachers and principals on their benefit packages. And that opened up the world to me. Then clients were begging me to help them with this Medicare maze, some people call it, because there are so many ways to go. I could probably think of 88 different plans that you, Irma, might choose right now. It's like mind-boggling. It's excellent coverage, though. I'm on Medicare myself. I'm 66. Medicare, I've seen my family members go through open heart surgery, major, almost an organ transplant, but at the last minute, my brother-in-law's lungs actually improved. And at 82, they said, no, I'm sorry, we're not going to do a transplant. It's excellent insurance. People that are coming off of a work plan, going into Medicare, that's the most common question they ask me. Is it any good coverage? Is it going to cover everything?
Just as I'm hearing on the TV or seeing on the TV, hearing on radio and everything, they're always saying, well, you know, it doesn't cover everything, only 80%, and you need a supplement. What's this whole balance between the plan, the original plan, and the supplements? And then I want to make sure we cover all those different parts, A, B, C, D, yes, all of that. So take us through some of it.
Whew, how much time have you got? The basics are, there are 4 parts of Medicare, A, B, C, and D. A is really hospitalization. We all get that free when we turn 65 and we've worked at least 10 years. Part B of Medicare covers anything other than a hospital stay. Outpatient surgery, doctor visits, MRIs, lab work. B, you have to sign up for. And every once in a while, somebody doesn't get told that they need Part B when they're 65 years old. Then C and D, those are more the Medicare Advantage and the prescription drug plan world. C and D usually comes bundled as a Medicare Advantage plan. And the TV commercials about, you know, Medicare only pays for 80% of and you're responsible for 20%, that's talking about Medicare supplements. Supplements are the old plans that were started with Lyndon Johnson back when Medicare started, when insurance companies wouldn't insure us because anyone over 65 was just too risky, too sick, too much problems. Insurance would drop you. And years back, folks, I couldn't imagine retiring with maybe your house paid off, and then you had to pay for all of your health insurance, surgeries, medicines, and people did. So I'm glad Medicare came out, and it's actually a government plan. So to get back on all the different plans, the supplement used to be the only thing available, and their Part B of Medicare pays 80% of the cost, and you pick up 20%. And that 20% has no ceiling. It just goes and goes and goes and goes. So there's a liability there. And I encourage anyone to get a supplement or a Medicare Advantage with their Medicare. They're all designed to work together as one cohesive package, but they're very different.
How do you actually wade through all the information to figure out what's best for you?
I found a very easy solution. I usually interview the client, find out first where they live, because depending on your county and zip code, different plans are available to different people in different areas. Then we talk about your health needs and maybe future needs. Some people do know they need a knee replacement coming up, and some people know they have chronic this or that. And I'll make sure I'll put them in a plan that's going to meet their needs. I go over a list of their doctors if they want to share it with me, and what hospital they'd want to go to if they need to go to a hospital stay, and most importantly, a list of their medicines, because not all plans cover all drugs. So it can take hours and hours, and usually 1 or 2 meetings with a client. But folks really like the fact that I personalize every visit, and sometimes even a husband and wife, I'll recommend different plans or different insurance companies.
Because of their own work background, or why would, I mean, they're living in the same house, the same community, why would there be a difference?
Sounds funny, doesn't it?
It sure does.
Well, if their health was identical and they took the same medicines and had the same doctor list, they might be in the same plan. But many often, one is healthier and one is sicker. And so if the husband and wife have different health challenges and different diagnoses, then I tailor a plan just for that person. Because in the Medicare world, family plans, spousal coverage, that's all gone. Everything's individual.
That's a big change from the way most people had their health care insurance handled when they were working, because generally there was provisions for family or for spouse or such.
Right.
How in the world did you ever learn all this?
Oh, you little bit by bit. I just finished 2 months of training. Every year there's training. I do webinars, I have to take tests, I have to certify, blah, blah, blah. And then I read. You know, I do the mandatory, certifications, but I learn all the time. I talk to all my clients and ask them to give me feedback. Because if I put someone in a plan, I do call them back at least once a year, if not more often. And I'll ask, if you have a major event, please call me and tell me how the insurance worked, because I get feedback from the field of how the companies really handled it. Which companies leave you on hold for an hour, and which companies answer their phone, and with a happy voice that gives you answers. So there's that customer service end too.
Or which ones make you go through all the press 1, press 2, press 3, press 4, if you want this, if you want that.
Yeah.
And by the time you figure out which button to press, you lost the call.
Hopefully most of the customer service calls aren't like that. Now the government calls, if you call Medicare or Social Security or you want some sort of subsidy or help with say your income is just fixed and it's low and you want some help, then you've got to go out and reach a government agency. And those I've heard nightmare stories about. But most of the Medicare plans, there's an appeals and grievance process. We have more rights with Medicare, I think. And if you don't like how long you hold on the telephone, you could actually make a grievance and report it. If you think you waited too long at a doctor's office or you had to wait 6 weeks to get an appointment, these are things that Medicare actually wants to know about. They want their clients to be treated with top glove care.
I guess I never thought about it that way. I just thought, oh, well, it's another plan and it's something that happens when you're 65. And I didn't realize that there was that much focus on it.
There's a lot to Medicare. That's why I actually shut down my other practices and I'm a specialist in the healthcare world. I found out that I really had to keep up. I didn't want to dabble in it and then give people a little bit of advice and not give them the whole story.
Well, from what you're saying, it is an ever-changing field that you have to keep up with, not only from what is prescribed in Medicare, but how the different companies are interpreting it or what they're providing in terms of their plans. What are the questions that most frequently pop up when you meet a new client?
Usually they'll want to know what the coverage is, what the limitations are. Have other people been in this plan? They don't want to be the first one to be the guinea pig. How long the company's been doing this? And usually once we have about an hour meeting, people get reassured that yes, that I know what I'm talking about and that they're going to be covered. Medicare has a wonderful provision in that anything medically necessary will be covered. So you don't have to list every single item as long as your doctor is the one who makes the case. You don't have to show proof to Medicare why you need this or that or this treatment. Your doctor does it for you. So people like the fact that their doctor can actually submit a claim form, a recommendation, and Medicare usually defers to the doctor's wisdom.
Because their office staff is trained to understand the forms and the requirements?
They are. Hopefully they're trained. Things change so quickly. If ever there's a claim issue when I get involved with my clients, it's usually because the doctor's office or some billing clerk has a code error. If it ever isn't paid, that so far 100% of the time that's been the problem. You just go back to the doctor's office and say, oh my goodness, you either billed the wrong card, the wrong company, this or that. And when you're with a Medicare supplement, your doctors, providers, clinics, labs, hospitals, they have to bill Medicare first because in the supplemental world, Medicare is the primary payer. In the Medicare Advantage world, this is one of the big areas of confusion. Providers even get mixed up because they'll ask to see your Medicare card. They'll bill Medicare and Medicare denies it. In the Medicare Advantage world, the provider has to bill Medicare Advantage, that company first.
Well, that's different from the way most claims are handled, isn't it?
It is different, and the poor doctors are being squeezed and pushed, and there's more paperwork put on them, and their office staff is busy, and as you know, doctors are just filled up with patients. So I feel sorry for them, but it's that needed training that the staff has to have. And there'll be someone in each office who's their billing clerk, that they're very knowledgeable. Sometimes the receptionists try to help out, and that's where people get misinformation.
Well, is there anything that a patient can do to help the staff? What are the, I don't want to say obligations, but what are the helps, the assistance that a patient can give to the doctor's office in terms of making sure that these claims go through properly?
Show the right insurance card, and with Medicare Advantage, every year you might get a new card. So make sure new cards usually go out middle of December. So make sure in December, when you go there in January 1st, when plans start, that you show your new insurance card.
So I guess I've gotten the card every year, but I just thought, oh, well, they're issuing a new card. You really have to make sure that you're carrying and showing the most current card. And even if they look alike, they may not be alike.
Exactly. They look very similar. And I tell people when the new one comes, and it's tough because the new one arrives in December. So I say put it in an envelope, and then on January 1st, start showing the new one and cut up the old one.
Oh, sure. I guess that makes a lot of sense because through the end of the month, you still have to use the old one.
That's right, till December 31st at midnight.
You can't use the new one until January 1st. And it's not like that's the only thing that's on your mind through that hectic holiday season.
I know, I know.
You mentioned something a little while ago when you were talking about the institution of Medicare, and that was back then 65 and you're out of so many plans. We don't look on 65 as being that old anymore. Are you finding a wide range of over 65s in your practice?
Oh, yes. And I love, what's happened to age anymore. We're redefining retirement right now. You see folks in retirement doing skydiving, starting new companies, traveling the world. We're like breaking boundaries. We're not all just sitting home making cookies and just, knitting. I love the fact that and the baby boomers especially, they're coming through the system right now, and we've changed everything we've touched, the boomers. And we're living longer. We're healthier, we've got better lifestyles, procedures, and medical, advancements. They perform miracles. I meet a miracle person about once a month, a person who 5 or 10 years ago wouldn't have been here, that they've saved his life. In fact, the Census Bureau, there were so many people in age 90 and over 100 that the Census Bureau had to actually open up a whole nother demographic for folks in their 90s and 100 plus. Years ago, that was just called old people, and they just sort of wrote you off as a non-existing section of the economy. And we have buying power. We buy things. If you go to restaurants, you'll see, look around, over half the room is people that are retired because we have the time and the money.
We were fortunate to be working during a time when there was a lot of prosperity and there were excellent plans, both in savings and in benefits and such. And some of those plans, though, now people are being faced with finding that the benefits they thought they would have for the rest of their life are disappearing, are being discontinued. What's the situation with that?
Oh my, now that's a whole new topic. The legacy costs for companies to carry their retirees, it's draining the companies. If you look at the young people, they're not having children and babies as quick as we did, and everything is lopsided. Companies, when they gave you retirement benefits, they assumed we were all gonna, have a shorter lifespan, but we're outliving all the tables. We're breaking all the rules. So companies are finding out that they have to actually cut benefits back for their retirees. We see it all the time, every year. Years back, I remember a couple years ago when Bridgestone and Firestone sent all the employees, the retirees, they always had their health insurance through their retiree plans, and they said that we're going to drop it. And they assist you and they help you phase in. And they do that with a good conscience because the Medicare insurance plans are so rich. I find them to be very adequate. So they're not throwing you to the wolves and saying, oh, we're a big bad wolf. They're giving you a transition to go into the regular individual Medicare world. And I think it's excellent insurance.
The biggest problem then is figuring out how to make that transition.
That's right, because it's very tricky to transition. You've got to do it at the right time. You've got to do the right paperwork. You've got to get it submitted. And picking that right plan is what most people really spend time on.
What are the biggest mistakes that people are making when they try to either make that transition or they turn 65 and they're getting enrolled in Medicare and they need to look for a supplement or an Advantage plan? What are the biggest drawbacks? I guess drawbacks isn't the word so much as what are people doing that maybe is wrong? approaching it in the wrong way?
Well, I see mistakes sometimes, like just yesterday. A gal said her brother was turning 65, and she said, oh, I told him he has to wait until full retirement age of 66 to get his Medicare. And I said, oh, well, actually you have it a little bit confused. Full retirement age is a Social Security term, and anyone born after, I think it's 1942, has to work age 66 to get their full retirement Social Security benefit. But Medicare is still based on 65, turning 65, or at any age if you have disability. I have some clients on Medicare that are 19 years old. A fellow kid was in a car accident, and he's actually paralyzed. And after 2 years, he qualified for Medicare. So people can get it at any age. A mistake folks would make is, one gal signed up for a Medicare supplement and didn't realize she needed a prescription drug plan. And if you don't get a prescription drug plan when you first are eligible for Medicare, and you come later on and want to get one, Medicare is going to assess a late enrollment penalty. And the bad thing about that penalty, it's only maybe, I think it's 35 cents per month every month you're not in, but that penalty stays with you for life. So if you, like she now has no drug plan, and I said, well, luckily open enrollment starts on the 15th of October, and in January you'll have a drug plan, but she has a year and a half where she didn't have a drug plan, so she'll owe about $7 extra as a penalty every month for the rest of her life, and she's 66. So, and she was upset that when she signed up for a supplemental plan, they didn't offer her a drug plan, didn't tell her about it, didn't warn her if she didn't get one right then that there would be a problem.
That's quite a penalty to assess onto a plan essentially in perpetuity.
It is. And Part B has a similar late enrollment penalty. If you don't get it when you can, and you drop out, some people don't pay their bills. Every once in a while somebody, because Part B has a monthly bill. If you're smart and you're on Social Security, you can get it deducted right out of your Social Security check. You just set up some paperwork. Other people who are younger and not getting Social Security, they want to pay a bill. And one fellow had actually forgotten to pay his bill. He was 6 months behind, and Social Security canceled him. So then he had to wait until their open enrollment, unlike the Medicare Advantage open enrollment, starts in January till March 31st. So he finally signed up, and then it didn't start until June. They have goofy rules, our government does. But he owed a late enrollment penalty because he had been like 9 months without Part B. So I guess it's just important to make sure you're doing everything right. And to me, I don't charge for my time and services. It's a no obligation visit with me, and I like to be informative, and I do a lot of volunteer work. I like to make sure people know their rights and know what to do when, and how to do it. So I don't charge for my time. Now I do make a living, because if you sign up with an insurance plan, the plan will pay me a commission, but it's from their profits. It's the same if you go direct or go through an agent. So I think it's one of the biggest bargains out there right now.
Now, you have a website, don't you, where people can get some information?
I do. My website is www.victorinsurance.biz. It's biz, not com. That's going to throw some people.
But it sounds like you have a wealth of information. What advice do you give to people who are going through this for the first time, or are not even for the first time, but maybe reassessing what they've had throughout their lives up to now?
Well, I recommend get help. Don't try to sort it on your own. Lots of people, one fellow called me 4 years before he turned 65, he'd started researching Medicare. He was on every website out there. When we met, he had more partial information of things that he got from the internet. And I had to sort of straighten him out for hours over, well, this is true if you go this route. But it only applies in this situation. Because actually, as an agent, I have 19 pages of special enrollment situations when people can switch plans and do this and that. It's daunting to try to do what I do. It's taken me years and years to know how to do what I do. So to me, I think the biggest mistake would be doing it on your own. And then each year you have to watch. Say you spent all that time and you picked a perfect plan in 2014. If you're not careful, plans will send you a notice of change, and things keep changing in our insurance world. Maybe your doctor was in back in 14, but the doctor's offices can go out of network anytime they want or stop accepting a certain insurance company. And that's when people might call me in the middle of June when you can't switch and say, I went to the doctor and they said they don't accept my plan anymore. So those are the two mistakes I see people make, not proactively, just because it worked last year. You have to check each year to make sure your medicines and your doctors and providers are all in the network.
Well, Bonnie, I am so glad you were able to spend time with us today, because you've certainly opened up our eyes to a lot of things and to the advantages that are out there for us. And all of you, I'm so glad you've spent today with us. Please do tune in again, and thank you. Have a wonderful day.
Since 1971, RSVP has been matching volunteers' talents to community needs. RSVP is affiliated with the Corporation for National and Community Service, a national organization that supports service and volunteering through grant-funded projects. Volunteers organize neighborhood watch programs, tutor children, renovate homes, plant community gardens, assist victims of natural disasters, and serve their communities in many other ways. RSVP offers maximum flexibility and choice to its volunteers as it matches the personal interests and skills of Americans 55 and older with opportunities to serve their communities. If you're interested in adding more meaning to your life and improving the lives of others, please call 330-253-4597 extension 166.